and welcome to those of you who are joining me on Zoom. We are waiting just a minute for the feed to go live on Facebook. So hold on tight for about another 30 seconds and we will get started. Good evening and welcome to episode number 13 of the Hope for Healing video podcast series. I'm Dr. John Stracks and I'm joining you from my office here in Chicago. I'm aware that this time of year can be challenging, and as we enter into the holiday season, even more so this year, given that the pandemic is still going on. And so rather than interview a guest this week, I'm going to spend the hour answering as many of your mind-body medicine questions as I can. And before I dive in, I'll tell you just a little bit about Hope for Healing. It's a joint effort between people at the Curable app and me. And for those of you who aren't familiar with either of us, I'm a physician here in Chicago who focuses on the reduction and elimination of physical symptoms using mind-body medicine methods, and Curable is an amazing app focused on the same goal. So we've been working together since their inception about 5 years ago. Before we get started, I'll be answering questions live this evening, as many as I can over the hour. And so if you do have a question, you can go ahead and post it now or at any point during the hour into the Q&A feed here on Zoom, if you're with me on Zoom, or into the chat on Facebook, if you're following on Facebook Live. My friends at Curable are monitoring both of those feeds. Will get the questions to me, and I'll get through as many as I have time for. Secondly, as many of you know, I've been able to expand my telehealth practice significantly during COVID-19 and working to sustain that even once the pandemic is over. So no matter where you are, if you're feeling stuck and are interested in reaching out to me individually, go ahead and contact my office through my website at www.drstracks.com. My staff will get in touch with you and let you know how you'd be available to talk with me directly about what you're dealing with. And lastly, just a minute about my framework for talking about healing from a mind-body medicine perspective. I think that our bodies express what's going on in our minds and in our lives. And I think that's universal. It doesn't Doing that, expressing in our bodies what's happening in our lives, doesn't make us bad or make us sick. It only makes us human. And so it only becomes, quote, bad if you enter into a medical system that doesn't understand this concept and assumes that all physical symptoms are physical in origin. I think human beings have always expressed our lives in our bodies, and I think we always will. And so our goal, my goal, Curable's goal, is to help you understand this and to learn what to do about it so that it's no longer physically uncomfortable or painful for you. That's what we're trying to get to. So with that, let me dive in and get to some of the questions. And so the first one that came in was about hip replacements, and do I think hip replacements are necessary? And so I've had several patients who have been considering hip replacements. I talked to somebody even earlier this week, considering hip replacements and decided not to after they learned about mind-body medicine and have done fine over time. I have also, unfortunately, talked with many patients over the years who have had hip replacements and they've not gone as well as they would have liked. And so I've seen people who are still having symptoms and still limping even several years after the procedure. And so my concern about hip replacements in general is that they're not always as successful as the surgeons would like them to be. And so I don't have people go into them lightly. I think that, as many of you know, um, what we see on images and what we see in terms of CT scans and X-rays doesn't do a very good job of predicting who's going to have symptoms. And so even when people come into my office and have an X-ray or an MRI of their hip that shows wear and tear or cartilage degeneration or labral tears, I know from the studies that that doesn't necessarily predict who's going to have pain. And so I'm comfortable with a lot of people who come into my office with that particular question, guiding them away from hip replacements and towards this kind of work. And I think for a lot of people over the years, that's been quite effective. So the next question that came in here says, I have a problem of facial pain from two side-by-side tooth root canals that went wrong and has caused facial pain over the left side of my face for 25 years. Day and nighttime clenching with aggravated teeth and the gums and the facial muscles. How to approach the brain to help stop the clenching, which is flaring up the rest of the symptoms. And so I get asked this question a lot, especially in terms of symptoms that are going on at nighttime and overnight. And I know that when we're sleeping, we don't have very much conscious control over what's going on. And so what I do when symptoms are going on in the nighttime hours is generally have people do some pre-work before they go to bed. And that can look like going over with themselves what's going on that's stressful and maybe reviewing their day or writing down some of those things and putting it away. I have people talk to their brains and remind their brains that there's nothing going on in the middle of the night that's so dangerous that they have to brace themselves. And so spending some time reflecting that way in the minutes before bed and trying to get your subconscious to understand, like, it's okay. The clenching and the bracing is not going to be helpful in this particular situation. And sometimes that's helpful in controlling the symptoms overnight. I have people try to get a sense of whether there's anything going on underneath the surface that may be causing this. So any hidden stressors that they're not aware of. Oftentimes there can be hidden emotions like anger or fear or sadness. And so try to have patients dig those up and see if there's anything that occurs to them that might be helpful to look at and sort out before they go to bed. And sometimes that's helpful as well. And then I also sometimes, if there's a lot of clenching going on, I sometimes have people just notice it. And when they notice it, practice relaxing the area on a regular basis, even if they're not clenching. And sometimes that kind of musculoskeletal repetitiveness actually does help decrease the amount of clenching that goes on both during the day and in the evening. And so those are some of my thoughts about symptoms, especially the clenching and the bracing that shows up in the overnight hours. Next question here. Been hypothyroid since 1994, and do I think that hypothyroid issues can be resolved with TMS methods, and if so, how? I've heard other practitioners discuss autoimmune issues as mind-body, and can long COVID be TMS as well? So a couple different questions in there. I'll try to briefly answer each of them. So I do a lot of endocrinology in my practice when I'm not doing a mind-body medicine practice. And so I have seen probably over 2,000 patients with thyroid disease over my 10-year career. And I don't think that thyroid issues themselves are a mind-body disorder in almost all cases. And so people have been on medication for a long time. I don't work to get them off medication. But this is what I have noticed, that my patients who are taking care of themselves in a variety of ways, including mind-body medicine, have much more forgiving labs than my patients who are only focused on the dose of the medication. And so a number of my patients who are active in the mind-body medicine world and also take thyroid, I can get their labs back and they can look just not very good and they are feeling great. Whereas a lot of my patients who are just focused on the dosing, if their labs don't look tip top, they're not feeling very well. And sometimes even if the labs do look great, they're not feeling particularly well. And so I don't try to resolve thyroid issues completely as if they're mind body, but a lot of the symptoms that people experience, I think, are related to stress and non-physical factors. And so if people are looking for precision in the labs and feel like they can only feel well when the labs look perfect, oftentimes there's a lot that can be done in this arena that is helpful for people. And so I wouldn't try to get someone off medication, but I would encourage them to look at stress and other non-physical factors for the symptoms we normally think of as thyroid. As for autoimmune disease, if someone comes to my office and wants to talk about autoimmune disease, mind-body medicine, tension myositis syndrome, which is another term that we use for it, I'm usually doing that as part of what I'm doing, but I also probably would look at some other factors, including what people are eating and what supplements they're using and how their hormones look. And so I see autoimmune issues as having a wide variety of causes, stress being a common one, and trauma, interestingly, being a common one. And so Donna Jackson Nakazawa, who wrote the book, The Last Best Cure, has really nicely mapped out the state of the science and what we know and the relationship between trauma and autoimmune disease. Bessel van der Kolk, who wrote the book, The Body Keeps the Score, The Body Keeps the Score, is another one who makes that link between trauma and immunity. And so I do think that from a stress management and a psychological side, we can calm down the immune system and decrease autoimmune issues that people have. I think there are other ways that we can do that as well. So mind-body medicine is a part of my treatment for autoimmune disease. It's not the whole treatment. And then COVID long haul symptoms are interesting. And it's obviously controversial and nobody knows for sure because it is so new. This is what I've been saying about COVID lately, is that in our society in 2020, in the United States and probably Europe and other countries, for those of you listening from abroad, it is very hard to trust what our eyes are telling us. And so the example I use is that I frequently will look at my phone, which will say it's raining. And then I'll look outside and it doesn't look like it's raining, but I'll kind of make the decision that it's raining because my phone says so, even though I can tell that it's really not. And so there's so many stories out there, and the pandemic has obviously been deadly to a huge number of people around the world, but almost all of those people are older. A lot of them, at least in the United States, are in nursing homes and have pre-existing conditions. And so for people who are younger and healthy, it has not been particularly dangerous. And my experience with the people in my practice is that there's been no complications when people have had COVID, and there are no long haul symptoms either. And so my experience with people is that the long haul symptoms are not a major issue. Now, that said, I know that people are having them, but I have some suspicions that they're more on the mind-body medicine side than on the more conventional or medical side. I had one patient who contacted me with long haul symptoms, but she's had 7 negative COVID tests. And so I'm not convinced that the symptoms are related to an infectious disease as much as I am convinced that the symptoms are in line with what we talk about mind-body medicine. And so I'm moving forward for the time being that a lot of what we're seeing as COVID long haul is actually mind-body. Next one, post-concussive syndrome. And so I've completed the curable program, but still having trouble accepting that the brain is creating the pain because the pain is already in the brain. And so I do think that a lot of the post-concussive symptoms that people get are in this mind-body medicine arena. And so, so if somebody comes in to me with post-concussive symptoms, especially if it's a long time after the injury, we're trying to treat it in this way. And so we're doing the things that we normally do. What are the underlying emotions? Where are the stressors? How much trauma have people experienced in their lives? And I've seen a number of patients over time who have really managed to decrease those symptoms significantly using these methods. And so it's about decreasing the fear that something is wrong. At its most basic point, mind-body medicine is about understanding that our bodies are not sick and not broken in the way that we're afraid that they are. And so if we can reduce the fear of what's going on in our body, and we can make that decision on some level that our bodies are more resilient and more healthy than we've been led to believe, that helps reduce the number and the severity of the symptoms that people are having. And so it obviously in this society, there's a lot of fear about what symptoms mean. And the internet does not help with that, because at the touch of a button, we can get 100 articles that talk about how dangerous this might be or how dangerous that might be. But even in the post-concussive area, I think if you can become more comfortable with the idea that your symptoms are more a response to what you feel in your body as opposed to a problem of what's going on in your body or your brain, you can get a lot of traction, you can make a lot of headway that way. And so I would, if it were me and I were having those symptoms, this is the approach that I would be taking. Chronic migraines. I used to have chronic migraines that lasted for months at a time. Found curable in June, and the migraine was gone for a month. I was migraine free until a few days ago. And now it seems no matter what journaling or meditating I do, I can't get rid of this particular migraine. So I'm scared it's going to last months and get worse. What can I do? I know this works because I've experienced it, but I'm not sure how to fix this one. And so obviously it's common for people to get better and then have something pop up and you feel like you're starting over again or back at the beginning. And what I find with a lot of my patients who have had migraines and have done well, and you've probably listened. If you haven't, there are two patients, Jessica Dixon and Jill Rydell, who have told their story on Hope for Healing, and so you can find that at our Hope for Healing landing page, both of those interviews. But a lot of my patients, when they have migraines, they do quite well by trying to interpret what the migraine is telling them. And so I think that's probably, if you're journaling and meditating, that's probably part of what you're doing. And so some of the questions that I try to ask when people are struggling with this is, what's going on today? What went on yesterday? What's going on tomorrow? And so are there things that are going on in your life that may be showing up in a migraine? I think a really big one is the emotions. And so oftentimes when we have emotions, we're not aware of them, especially if we're prone to migraines, they will show up in the form of a migraine. And so trying to get a sense, is there anger there? Is there sadness? Is there fear? Is there guilt? But is there some emotion that's coming out in the form of a migraine? That's another thing that I would think about. If you're doing a lot of journaling, I have a rule that you can't attack yourself in the journal writing. And so when my patients are journaling and not doing well, almost always, if I ask them what they're writing about how badly they've messed up one thing or another. And so I have a rule that if you're attacking yourself in the writing, you have to stop because it doesn't ever seem to be helpful. And so if there's anything about yourself that you're getting mad at with the journaling, I would stop that, and I would see if you can turn it outward. And is there something outward that you're mad about that might be showing up in your head? And then I guess my last thought on it for the time being, without knowing the specifics, are there are times when just watching and sitting and observing is the right thing to do. And so, so two quick stories about that. I don't get migraines anymore. I did at one time in my life, not terrible, but over the past 25 years, I've had one, and it came after a 100-mile bike ride. I think I had overhydrated. And so, it started to form. I was on my way home from Wisconsin. And by the time I got home, like it really did feel like there was an ice pick going through the back of my eye socket. And so one thought I had was, okay, like this is good. It helps me understand what my patients are going through. And my second was, I'm Dr. Stracks, I can make this go away. So I was like, migraine, go away, get out of here. And I almost vomited, like it was that intense. And so I thought, well, that's not going to be helpful. And so, then I just sat and I watched and I waited. And as I watched and observed it, I saw that like it wasn't a monolithic ice pick. It would like come in and it would feel like that, but then it would roll out a little bit and then come back in, and have to take the ice pick out of my eye. And as I watched and waited, that pattern started to emerge, and I noticed that it was going away for longer and longer periods of time, and it wasn't quite as intense when it came back in. And over the course of maybe an hour or so, a little bit more, it rolled out one final time and didn't come back. And so sometimes we have to sit with it, we have to approach it. Another one of my patients said that after she learned about this, she didn't have very many, but she had a particularly stubborn one, and she was in the process of taking the medical school admission test. And so she said she was in the shower and she turned toward the migraine and said, migraine, like, what do you want? And so the migraine was so startled that it just blurted out, like, I'm scared. She's like, good, I'm scared too. Now we can deal with it. And so approaching into the migraine as opposed to trying to get it to go away, that sometimes is helpful as well. Next question is about POTS. Can you tell us about patients who've recovered from POTS using these techniques? And so there's a lot of confusion about what POTS is. I don't think we have a great scientific understanding of it. There are some people who are equating POTS with COVID long haul symptoms. And so, as I said, I'm thinking, at least until proven otherwise, that the long haul symptoms are mind-body medicine. But I think my patients with POTS who've done well, they really start by trying to get less scared of the symptoms. And so whether it's the dizziness or the fatigue or the rapid heart rate, they really work to understand that though it feels scary, it's not necessarily scary. And there's a big difference and an important discrimination, that we can feel things in our body that for all the world feel like we are going to die, when in fact we're not. Heart palpitations is another. I can have my heart going 170 beats a minute and it feels like something has to be wrong. And heart palpitations are never dangerous. They're inconvenient and they're scary, but they're never dangerous. And so trying to work on that idea that this is not our body's way of telling us that something's dramatically wrong. It's our body overreacting to a stimulus, maybe adrenaline, maybe the counter to adrenaline or the parasympathetic nervous system. And so really getting straight in our minds that we are not in mortal danger because we have this syndrome. And then POTS, I think a lot of times is an overreaction to both the adrenaline and the counter to the adrenaline. And so anything that can help reduce the effects of adrenaline in the body, so meditation, relaxation, gentle exercise, yoga, tai chi. And so starting very slowly to do those types of exercises and activities, I think builds up our ability to not have our body react so strongly. I do think there's a trauma component in a lot of cases to POTS. And so working through some of the previous experiences that we've had, and then very slowly exposing ourselves to the situations that cause symptoms, because if we're scared of the situations, then we avoid. When we avoid, we get into trouble. And so very gradually and very slowly putting ourselves in the situations where we have the symptoms and noticing that we're okay when we have them. And the more we can do that, and syndromes like POTS they're just slow. It takes a long time, it takes a lot of patience, it takes a lot of self-kindness. And so giving ourselves room to move really, really slowly and really, really gradually, and having a ton of patience with ourselves, because there's so much up and down to it. We can feel like we're doing well, and then we get a terrible episode of it. And so self-compassion and self-kindness are essential. Talk to a lot of people about those topics, POTS or otherwise. And one of the things I've been saying to my patients lately is that I have decided that self-compassion is a non-negotiable aspect to healing. We can have symptoms, we can be kind to ourselves, but we can't, say that right, we can have symptoms, or we can feel better, or we can be critical of ourselves. We can't do both. I think I still messed that up, but we have to learn how to be compassionate to ourselves in our minds if we want to feel better. And with any disease, especially some of these longer syndromes, we oftentimes are very critical of ourselves if we're working on it and we're not getting better, or we're feeling like we're not doing it right. And so we have to learn to be able to tolerate the symptoms, treat ourselves with kindness when we fall down, give ourselves a hand, pick ourselves back up, and keep going. And it's just an essential part of getting better, an essential part of getting better from that particular condition as well. I hear a lot about mind-body connection for pain and anxiety, depression. I'm wondering about fatigue. And so can I talk for a second about a mind-body approach for chronic fatigue? I have a colleague in the mind-body medicine world who's a psychotherapist who got interested in this whole field because he had chronic fatigue and was able to work his way out of it through mind-body means. And so we know that there are people who have fatigue for whom these methods are effective. One of the things I think about when somebody's got fatigue is the concept of boundaries, which a lot of you are familiar with. And so one of my patients with chronic fatigue came into my office one day and I said, "How are you?" And she said, "I'm great." And I said, "Wow, like I never hear you say you're great. What's going on?" She said, "I stopped talking to my mother." And so that's not a specific prescription for anybody who's listening, but it highlights the fact that she was spending an enormous amount of energy trying to manage that relationship. And once she put a firm boundary in place and said, "I'm not doing this anymore," it freed up all this energy that she didn't recognize that she was putting out to manage it. And so that's one way that I think energy can start to flow back to us through non-physical treatments. I would also say that, like I've been saying, and like other conditions, when we feel a symptom, we normally assume that it's a sign that there's something wrong. And so they've done some nice studies with champion marathon runners. And marathon runners, as you know, they hit the wall at mile 23 or mile 24. And what we think is that like that's a point when their energy gets to a lower level. But it's not, it turns out to be a critical level. They've got plenty of energy left in their body, but because of their experiences, previous experiences, and the way their mind and body interact, the alarm bells go off. Something's wrong, and you need to take an energy. And so champion marathon runners, they feel the wall, but they know they're not in danger. And so they're able to push through it and keep going. And so like so many of these other conditions, when we feel tired, if we assume it's a sign that something is amiss, then we're going to look for medical treatments for it when it might not be a medical issue at all. And if we can make that decision that the fatigue isn't related to anything medically wrong, but it's one way that we're reacting to the world around us, then it frees us up to try to employ these methods into the healing that we're doing. I'll say, like, my own observation, I see it in my kids, if you're watching, hi, and thank you for the example, that I will see them pretty regularly say that they're tired when they're stressed, nervous, scared, angry at me. And, but what it sounds like when they say it is, I'm tired, and I'm sure they feel tired. But I think the fatigue in those cases is pushing aside something else that's under the surface, oftentimes a strong emotion, but it could be a stressor or a test or a game that's coming up or something that is difficult to look at. And so that's another way that I think about fatigue, like any other mind-body symptom, that there's something underneath the surface that we need to take a look at. And so those are some of the things I think about when I think about chronic fatigue. Like the POTS, it takes a while. And so a lot of kindness, a lot of sort of tolerating some ups and downs as we get better. But sticking with it and really trying to get a sense of, is there anything under the surface that's contributing? Next question is about trigeminal neuralgia. And so can that be healed through mind-body medicine? Yes, and so I have several patients with trigeminal neuralgia who have done quite well. Trigeminal neuralgia is severe oftentimes, and so it's a lot of pain that goes with it. And I have seen a lot underlying the surface. And so one of my patients with trigeminal neuralgia grew up in just a brutal household. And what he told me when he got better is that the pain of that severity was the only way that he could bear witness to the amount of violence that was present in his house growing up. And he had worked for a long time with a very skilled therapist to bring that out and look at it and make those changes. But some of my other patients with trigeminal neuralgia have had pretty significant events in their past. And so somebody comes in with trigeminal neuralgia, which is facial pain and pain sort of in this area by the ear and in the face. That's one of the things I'm investigating for is there a trauma in their past? I have two patients who I saw this year with similar symptoms who both had a mother with severe mental illness. And so it's only two people. And so I don't know if that's a trend necessarily, but it's something else that I will look at, sort of what was going on, even if there wasn't violence per se in the family growing up. Are there other issues that were difficult for people to deal with in their formative years? But I've definitely had a number of patients who have responded quite well to this type of treatment. And so if that's something that you're struggling with, yes, I do believe that you're in the right place. The next question is about the hip replacement question. And so, so two things, just very briefly. Yes, I think a lot of times hip replacements can be prevented by taking a mind-body medicine approach. And for the person who asked the question, we are recording this, and so it'll be up in on Curable website and my website and the Hope for Healing landing page within probably within 12 hours usually. And so if you missed my full answer to that question, we are recording it, and you'll be able to find it probably tomorrow morning would be my thought. So the next question is about plantar fasciitis. So I had a plantar fasciectomy with a Baxter nerve release 6 months ago, and it failed. Can plantar fasciitis be cured? Sorry that the surgery failed. Looks like there was a redo last week. But I do think that plantar fasciitis responds well to these approaches. And a couple of thoughts. I have a lot of patients who feel the plantar fasciitis, so the pain on the bottom of their foot, and it's worse in the morning. And so they get out of bed and they step down, and the pain like shoots through their foot, and they hobble into the bathroom. And so by the time they like brush their teeth and get into the shower, it's loosened up and they feel pretty good. And so I do think that the fascia will stiffen up overnight, the fascia covering of the foot or fascia elsewhere in our bodies. And I think the fascia holds on to a lot of trauma. And so for people who've had more stress in their lives, I think sometimes the fascia gets stiffer. But my patients with plantar fasciitis, if that's all it is, a couple of minutes as they walk out of bed in the morning, if they can make sure that they know that like this is not a sign of something significantly wrong, then that's it. And they don't have any symptoms the rest of the day, and they they go through the day and they're fine, and they go out, walk and run and do whatever they want. The next morning it may happen again, but same thing. As long as they don't worry about it, stress about it, then it tends to be a non-issue. The other side, I've had patients who've had the surgeries, and I've had patients who had the surgeries that have failed, and what I see is that like they worry about it, they stress about it, they think that something's wrong, and they have a medical disease that needs to be cured. And so then they're in the podiatry office and they're getting consultations from the orthopedist, and they're having surgeries, and oftentimes the surgeries don't work that well. And so if somebody has plantar fasciitis, I'm really working hard to try to decrease the fear and decrease the worry about what's going on. And so, so that's my main approach, because I think that it's common for the fascia to stiffen, and I think that's part of being who we are. And like I said, when stress is high, past or present, I think that there's even more that happens in our fascia, but I think that the more relaxation strategies, the more mind-body medicine strategies, the more healing we do, the less our fascia is likely to hold on to our experiences. I'm somebody who has a fair amount of stiffness in the mornings, especially when stress is high. Through most of the pandemic, I've been doing almost an hour of yoga in the mornings. And I think it's a nice way for me personally just to allow some of that loosening to happen and remind myself that my body's whole. I'm not damaged. I don't have to take on everybody's stress of quarantine. And so that's one of the methods that I use to work with that particular part of my body and keep my head in the right space so I don't get attached to that stiffness that I feel. Crips. I've had crips, post-surgical pain for 20 years. And I just had a flare up last night, didn't sleep until 6 this this morning. And so complex regional pain syndrome, full body burning was brutal. My mind was a battleground. I went everywhere from self-compassion, telling my pain it had done the job for long enough, and said, that's enough. So what would I say that would help in those situations? I think, the burning that goes along with that can be severe, and I've seen it be severe in people. And so when you get into a flare of a situation like that, it's essentially like it's an emergency in our brain, and so we have to treat it as such. And so it sounds like you did a lot of things right, and the self-compassion is important. Trying to tell the pain to go away is important. I think sometimes the best we can do is just sit and be with it and be patient. And that's not anybody's favorite prescription, but the story I told earlier about the migraine that I had, where I sat and I watched it and just noticed the pattern to it and the texture to it, and I just tried to breathe and remind myself that I was going to be okay. And sometimes that's just the best that we can do, and that's okay. Like, it's okay to have flare-ups. It's okay to have times where we can't control it. Our bodies are our bodies, and so we do the best that we can. We try to tip the playing field towards control of these situations as best as we can. And sometimes it just slips out of our control. And oftentimes there's something pretty stressful that's going on, or some significant trigger. And when it gets that bad, I think you did a lot of the right things. You sit, you watch, you wait, you give kindness to yourself. You can express the frustration, you can express um, the emotions, but sometimes, like, we just have to get through it, and that's the best we can do. And then you may find that, like, those flare-ups are fewer and fewer over time, as more and more time in between them. They're not as severe when they come on. But a lot of these conditions that we all have, like, that's how we get better. There's this up and down to it. And, like, we think we've got it licked, and then something will pop up and we have to deal with that. I was talking to one of my patients this week, who has had fibromyalgia and chronic head pain and a number of other conditions, and he's doing really, really, really well. And we were talking about part of the reason that he's doing well is because he's learned how to get through the flares, and they just have scared him less and less over time. And so, for better or for worse, getting through these flares is part of the healing. And so, even if it lasts longer than we want, even if it's more severe than we want it to be, when we know that, like, it will go up and come back down, the next time it may not go up quite as much, and it may not last quite as long. And so, despite all the work that we can do, sometimes we just have to duck and cover and wait and let it pass, and be kind to ourselves as we're doing it. Let's see. I'm from the United Kingdom, and I have fibromyalgia, widespread pain as a predominant symptom. I've had all the tests, they're all negative. I know that my symptoms are caused by my brain. I've been working with the TMS theory for about 9 months and I've seen very little change. Journaling, meditating, trying to dissociate the symptoms. Not sure what to do next. And so I know it's frustrating when you work really hard and you're not getting where you want to go. And so couple of thoughts I have. One, like, fibromyalgia can just take a long time. The person I just referred to has been working on this for a couple of years, maybe 2.5 years now, and has done well over that time, but has also had some big flare-ups as well. And so 9 months is a long time. It may not be long enough. The journaling, the meditating, as said, if the journaling is self-directed anger, that's not going to be helpful. And so make sure when you're journaling that you're expressing the anger outward as opposed to inward. And the self-compassion is another one. As I said, I just more and more, I think that self-compassion is a non-negotiable aspect to healing. And so I would really work hard to make sure that that's part of what you're doing. If there's any of that going on, any self-attack, any self-recrimination, that's not compatible with getting over fibromyalgia. I did a study, an unpublished study, when I was a medical resident, where we interviewed fibromyalgia patients, specifically about amount of trauma that they had experienced over the course of their lives. And the amount of trauma that we uncovered in that study was literally unspeakable, essentially why the study was never published. Like it freaked me out, and I didn't know what to do with it. And so anytime somebody comes in with fibromyalgia, I am trying to assess the trauma history and seeing if that's a part of what's going on and whether that can be worked on and healed over time. And then I've also been, during this year of pandemic, I've been studying cognitive therapy through the Feeling Good Institute, which is run by David Burns. And that type of cognitive therapy allows for looking at very specifically at what's going on with people. And so journal writing and meditating are good skills to be able to sort of zero in on what's the issue for you. But there may be specific issues that need to be worked on. And so that's another thing I would try to identify is self-criticism. One of them is trauma. One of them is, are there specific incidents? Are there relationship issues that need to be worked on or healed, or forgiveness that needs to happen? And so sometimes when we're doing a lot of work and not getting better, I try to look for like what specifically is going on underneath the surface that that may be contributing to the stuckness. So let's see. This question says, is focal dystonia a symptom of TMS and mind-body medicine? And so it's not something that I do a lot of treating of. And so my sense is that it probably is, and probably is a little bit more complex than some of the other symptoms, say like low back pain or neck pain. And so if you're dealing with focal dystonia, then I would really try to go deep and figure out, like, are there specific issues underneath the surface related to past experiences or traumatic experiences? And it may obviously have other medical causes as well, but I've seen it in patients who have that symptom that there have been some pretty significant issues underlying the symptom. And so I would look under the surface and see what's there if I was going to try to treat it as a mind-body medicine issue. Adrenal insufficiency. And so there's a difference between adrenal insufficiency and adrenal fatigue. And so adrenal insufficiency is probably an autoimmune disease in which the adrenal glands no longer make cortisol. And you can see that on lab tests. And if people, President John F. Kennedy supposedly had autoimmune adrenal insufficiency and was on steroids through most of his adult life. And so if our bodies are literally not making enough cortisol, then I do think we need to take the cortisol in order to heal the situation and be safe. Now, if we're talking about adrenal fatigue, which is not an autoimmune disease and is the idea that too much stress has put a strain on our body, I do think that's a version of mind-body medicine, and I do think it can be treated in this way. I frequently say to my patients who are struggling with that, like, what is it that nourishes your adrenal glands? And somebody said the other day to me, like, I don't understand. What are you talking about? And and by nourishing our adrenal glands, it's different for everybody. But for instance, like an 8-mile run can be incredibly rejuvenating and nourishing for one person. And then for me, that would take everything out of me that I would have for 2 weeks in order to do that. And so when we're sort of diagnosed with, say, adrenal fatigue, know that it may be another word for mind-body medicine, but what aren't you getting in your life that you need to have? Is it nourishment from relationships, nourishment from sleep, nourishment from food, nourishment from your own brain, nourishment from other people? And so I think of it in that way and would approach it in that way. And so what are the non-medicinal, non-medical parts that you can bring into your life that feel healing for you? And that's how I would think about it. I've had a TMJ disorder since 2004. And so MRI says non-reducing anteriorly displaced discs in both TMJs. I have osteoarthritis in both TMJs, class 2 occlusion, moderate osseous degenerative changes, told it's structural. Can TMS work help me? My sense is yes. And I have a patient who's struggling with TMJ at the moment and has been working with specialists, and she gets scans every maybe 6 months. And it feels to me a lot like mind-body medicine. It's they're making the diagnosis based on the scans, and scans don't really agree with how she's feeling. She's feeling good, but then she keeps going back and she keeps getting scared and saying like, oh, it's getting worse, so we may need to do replacements. And it seems the same to me as what we see from these studies that have been done over time that show that discs in the spinal canal don't predict pain in people. And so to try to help my patients dealing with TMJ to lose the fear, to believe their eyes and not necessarily the scans. And so as you work on it, you start to have some success. This is what my patient is dealing with, to know that that success is real and doesn't get discounted just because of what they see on the x-rays or the CT scans. And so really trying to reduce the fear and then working on the TMJs, if it's mind-body medicine, I think is reasonable. COVID long haul symptoms as compared to Lyme. And so there's a ton of controversy about Lyme disease, and in a lot of different ways. And so this is what I would say about Lyme disease, is that I have had plenty of patients over the years come in and tell me that either they have Lyme disease or think they have Lyme disease. And when I first started my career, 11 years ago, 2009, I was working at the Integrative Medicine Center at Northwestern Hospital in Chicago, and my job was to see everybody. And so I was already doing the mind-body medicine work, but other than that, I didn't have a ton of preconceived notions about what was helpful and not helpful for people. Ultimately, I ended up doing a lot of, say, thyroid work because I recognized that I could look and see what was going on with somebody's thyroid medication, and I could change things around and they could feel a lot better. And so I continued to do that work over time, and it was helpful for people. The Lyme work that I've tried to do over the years has not been helpful. I don't have patients for whom we tried to treat the Lyme one way or another, and I've tried to do it, but I've never really seen people get better. And so because of that, I made the decision at some point in my career that I wasn't going to try to treat it, because I didn't think that it was literally the bacteria that was causing the problem, which is now kind of what I'm saying with COVID long haul symptoms. I don't think it's an infectious issue, the virus or the ramifications of the virus. And yet I know that there are a lot of people out there who swear that Lyme is their problem. My experience with people has been that the Lyme itself is not what's causing the issue. And if people are interested, I'm happy to work with them in a mind-body medicine manner. I think a lot of times when people are dealing with what they think is Lyme, they're pretty committed to Lyme being the issue. And so they don't always want to take a look at it from this perspective. But the times I've seen people do that, it's been helpful. And so somebody comes to me sort of having a history of Lyme disease or wanting to treat Lyme, I let them know this, that I haven't seen the benefit in trying to treat it as Lyme, but I have seen a benefit in treating it as a mind-body medicine disorder. So let's see, it somehow amazingly is 5 minutes to the hour, and I have more questions here than I started with. And so I will answer a couple of more and apologize to those who I haven't gotten to yet. And clearly there's a need for more time answering people's questions. And so we'll see what we can continue to do over time. But let's see, untreated concussion, top 3 discs in my low back and in my neck, spine stimulator, I'm trying to use mind-body medicine. Can this replace the surgery? I would say absolutely. I think the studies are clear that disc issues and what you see on a CT or an MRI don't predict pain and symptoms in people. And so, so I'm totally comfortable with disc issues being treated as mind-body medicine. And I would not be in any rush to head into surgery and deal with it in that way. And so I would really try as hard as I could to use these kinds of strategies and techniques, trying to decrease the fear, get a sense of what's going on underneath the surface, and go at it that way. I don't know that I would push anybody into surgery before trying this first. Let's see, TMS as regard to structural issues as a result of a physical injury. And so, as I was saying, like it's hard sometimes to tell what's physical and what's not physical. Like we would think that a herniated disc is a physical injury, and yet there are a lot of disc issues out there that don't record as pain when we look at them on CTs and MRIs. And so I would be careful with what you're characterizing as a physical injury, because oftentimes it's coincidental, not causational. And that's the conclusion on the back CT and MRI studies, is that anything that we see is more likely a coincidence as opposed to a cause of the symptoms. If there's physical injury, broken leg, or a pulled muscle, time, patience, care, kindness. We're going to be back in January with 3 of my patients at once, interestingly, who have done quite well. One of whom, his injury stemmed from a severe fracture of his lower leg. And so he will talk some about what it's meant to recover from what was a devastating physical injury, but still understand that there's a major mind-body medicine component to it. I will say that one of the things he's been struggling with the most recently has been that self-compassion piece. And so that keeps coming back again and again and again. Non-negotiable part of healing is being kind to ourselves in our mind. And so, let's see, so 2 more questions. Number 1, any advice with the symptom imperative? And so symptoms that are moving around the body. And so I always say that once you've got the symptoms on the run, you're in a good place. And so it's much more difficult to make physical sense of symptoms that are in our shoulder one day and our hip the next day and down in our foot the next day. And so if you're able to move the symptoms around, you are doing well. You have to attack them the same way. So it's not a different condition. It's the same condition showing up in a different place. And so whatever you did to move the symptom out of your back, you're very likely to be able to do similar things to move it out of your shoulder too. And so keep thinking about it psychologically, keep focusing on what's going on underneath the surface, what the pain and the symptoms are distracting you from, keep working on the fear, keep working on calming your mind that something's wrong with your body. Each time it moves around, it's not a new disease, it's the same disease just showing up in a different place. And then last question for now. I'm tired of hurting all the time from fibromyalgia for 30 years. Any ideas? And so fibromyalgia is, it's painful, it's slow to treat, but it's definitely treatable. And so, so getting started, which you probably already have, but continuing. And the patient I mentioned earlier with fibromyalgia has been working on it for a couple of years. And, you know, we figured out the other day, he's probably spent on average about an hour a day on this, but regularly. And so that hour a day has accumulated over time to the point where he's probably spent 1,000 hours over his life working on this. And like I said, he's had a lot of success. He's had some flare-ups. He's in a really good place right now. He will also be speaking next month. And so, so sticking with it, looking at whether there's underlying trauma that needs to be healed. The book Upside, The New Science of Post-Traumatic Growth, Upside, The New Science of Post-Traumatic Growth. It's a really nice outline of what we know the science says is helpful with trauma. The other books that I've mentioned earlier, The Body Keeps the Score by Bessel van der Kolk and The Last Best Cure by Donna Jackson Nakazawa. Those are all places to get information about what we've learned we can do to help stimulate post-traumatic growth as opposed to post-traumatic stress. I've been stressing, obviously, the self-kindness aspect tonight. And so if you're healing from fibromyalgia, there's a big part of that, of the self-compassion that's important. Obviously, Curable has a ton of good information on what's healing for people, and giving yourself time and space and patience. And it's been 30 years, and so it's unlikely to go away just like that overnight. But if you work on it and keep pushing on it and be kind to yourself and listen to what others are saying and try different aspects. And it's my last comment for the evening. I heard a lecture recently that was a basic scientist talking about why a specific type of psychotherapy is helpful. And what he said is that from a mathematical perspective, complex systems can't be healed when they're stuck by pushing on them in one place. So we're human beings, we're complex systems, and we tend to be stubborn by design. If you could like push on my shoulder and all my molecules fall apart, then that's not a very good system for being a human being. And so we resist change in a lot of different ways. He was saying that this has now been mathematically proven, that if I'm stuck and I push myself just right here in this one spot, I'm unlikely to go very far. And so what the models say is that to unstick the system, you have to push in multiple places all at once. And I've known this intuitively for a long time. I know that if my patients with complex disease come in and say they only want to work on one thing at a time, I know that they're not going to get better. And this is an explanation from that. From a systems perspective, if we're that stuck, we have to approach it from multiple avenues in order to unstick the system. And so that would be my last thought, that if it's been a long time, it's unlikely to be any one strategy that's going to be useful. And so we try out different strategies, and it could be this one day and this the next day or the next week or the next month. But coming at it from a lot of different perspectives is ultimately what's going to make you better. And so with that, we will end for the evening. I know that there are a lot of unanswered questions, and so we will see what we can do about continuing to make this available for people. And I want to thank everybody who's been here listening and asking insightful questions, intelligent questions, and poignant questions. Every time I do this and I'm here with you all, I'm reminded about how blessed and touched I am to be part of this creative community, working hard on healing and working on it in this cutting edge way. So as I said earlier, I've been able to expand my telehealth options during the pandemic. And so if you're interested in contacting me, feel free to reach out through our website, drstracks.com. My staff will get back to you before too long with information about how to connect with me. And if you enjoyed this episode, you can find the recording tomorrow morning and all our previous episodes as well at Curable in My landing page, which is curablehealth.com/hope for healing, all one word. So you can sign up for either of our newsletters and get updates about upcoming episodes and everything else that's going on with the app and in my practice. And so I will be back in 4 weeks on Wednesday, January 13th at 5 p.m. Central Time with, as I mentioned, a panel of 3 of my patients with a variety of conditions who are in the midst of using mind-body medicine methods for healing, and also have created a community to do this together as well. So I hope you can join us on January 13th. And until then, thank you for being here with me this evening. I hope you have a fantastic holiday, and please continue to stay safe and healthy during this time. So with that, I will say good night to everybody.